All right. Have a look at this one. Your FY2 in GP, female, Daisy. She's 40. She's come to you with some concern. She has a daughter. She has a child, 2 months old. The child has got a yellow color rash on the head. Talk to her and address her concern. So it's a pediatric case or a dermatological case, actually. Skin dermatology, mostly you'll be able to make the diagnosis when you have a picture, right? So picture, it depends. I mean, can I see the picture in the beginning? Yes, but I would recommend see it in the later part of the station. But mostly dermatological scenario, they're also coming as teleconsultation. And the task will say that the mother has booked the appointment for her 2 months old kid because she has noticed some rash in his head. She has already emailed the picture of the rash. You can find the picture in the cubicle. So in this case, actually, the life becomes easy. When you go in the cubicle, you will be having the rash picture on the table, which makes your life easy, right? So if it is a teleconsultation, you're going to confirm the name, age, address. Are you able to hear me clearly? It's a good time to talk. All those things you will do, and then you'll start the consultation. All right. So I'll show you the picture, but let's do it without picture first. Let's see how we can make the diagnosis. How can I help you? My baby has developed a yellow rash on his head and I'm worried. Yeah, rash. Okay. Tell me a bit more about it. I just noticed like a week ago or 2 weeks ago, do a bit of Odipara here. And you know how to do the history for any rash, right? So if there is any redness, any ulceration, if there's any bleeding coming out, if it is increasing in size or not, and if it has changed in his size, shape, color, all those questions that you can ask. All right. So elaborate it properly. Anything makes it worse, anything makes it better. Have you tried anything? Yes, I've been washing his hair with baby shampoo, but it is not working. Okay, you can ask if there's any itching, any pain, all those things that you can ask, any redness, any swelling, all those questions. Now, whenever it comes to a child case, what you need to do, you need to make sure you're doing a quick screening if the child is healthy or not. Right? Rash is there, so I have to look for meningitis, fever, all those questions. So quickly cover those things as well. That's really, really important, right? So ask for any fever, any chills, change in the behavior. If the child is playful, child is taking the meal, eating, drinking well or not, all those questions you need to ask. Then you can quickly do birth history as well. How was the birth of the child? If you're happy with the immunization, if you're happy with the developmental milestone, any recent jab, and if he's formula fed or bottle fed, any recent changes in the diet plan, how is urine and stool, all those questions you can ask. Right? Also, the patient has got the rash. Is it only on the head or is it on the face as well? Is it also on the chest as well? Is it also on the nappy areas as well or not? Ask those questions as well. All right, and do the red flags, any fever, any meningitis, any like urine problem, tummy problem, crying excessively, not drinking meal, and is very cranky or not. Ask all those things, right? Then what happened is when you say, I would like to examine, this is what they give it to us. What comes in your mind if you see this head? So this is cradle cap, right? This is cradle cap, which is common and harmless skin condition. In infants, it appears a yellow, greasy, scaly patches, and sometimes on the face as well, and also sometimes on the nappy areas as well. Okay, so what's the management? It's caused by the overproduction of natural oil on the baby's skin. It's not because of poor hygiene. It's not because of poor hygiene. All right. All right. And so the treatment is continue washing your baby's scalp with mild baby shampoo. Sometimes what happens is the parents, they might be going for very, what do you say? Adult shampoo, which is very harsh. Don't do that, right? So just continue washing your baby's head. You can gently loosen your scales using a soft baby brush or maybe with your finger as well. If it is happening, if it's not happening, just don't worry about it. right? If it is persistent, you can try something else as well. You can apply a small amount of baby oil or maybe petroleum jelly before washing, can help to loosen the scale. Some people, they say coconut oil, that is also helpful. And a lot of people, they use it, but we couldn't find it on the NHS. NHS website is not mentioning it actually. Just be very careful. Don't go with olive oil. That is not given. Even make sure you avoid peanut oil as well. See, in the Western countries, mostly what happens is there are lots of allergies, mainly say, for example, from peanuts and all. So if you go for peanut oil, may not be a good idea, right? So I would say go with what is written in the NHS guidelines. So I will go with a small amount of baby oil or petroleum jelly so that it can loosen the scales. As I said, parents, they use coconut oil as well, which is okay. But olive oil and peanut oil is a big no. Yeah. Medicated shampoo, ketoconazole, that can be used as well after you get advice from the GP, from the doctors. I mean, you don't need to really do it. I mean, try these for persistent cases first. Yeah. Most of the cases for pediatrics that we have got, they are actually reassurance scenarios. Even Cradle Cap, this is also a reassurance scenario, but you need to be very careful. You have to mention when we have to be alarmed. That is the main thing. So, what is the reason of worry? So, do not pick at these skills as it may lead to irritation or infection. Avoid harsh shampoo and excessive washing as it can make the skin drier and can make the things worse. When to seek medical help? What is the red flag sign? If the rash spreads extensively, become red, swollen, or start oozing out, that is a sign of infection. Make sure you go to the hospital. Another is if baby seems unwell, having fever, not eating, drinking, excessive crying, go for it. Yeah. Cradle cap, it takes time. It takes a couple of months. It can take like a few months before it get cleared up completely. Harmless and should clear up over time. Most cases on 6 to 12 months of age. If it doesn't improve or worsens despite the treatment, you definitely can go to the clinic for the follow-up. Right? So that's what you have to do. So mostly the pediatric cases are actually reassurance scenario, but you need to ask the red flag questions. You need to give reassurance properly, and then you need to give proper warning signs as well. All right. So that's what we have got in Cradle.